in COVID-19 vaccines. We have not only passed our goal of vaccinating 80% of adults 18 and older, but last week we surpassed 80% of all eligible Marylanders aged 12 and older who've been vaccinated against COVID-19. Yesterday, we passed the incredible milestone of vaccinating 95% of all Marylanders 65 and older. With the help of our successful $1 million VaxU scholarship program, which wrapped up on Monday with 4 more scholarship recipients, a total of 20 $50,000 college scholarship winners, the percent of 12 to 17-year-olds in Maryland who've already now been fully vaccinated rose by 17 points in the 2 months of the program to more than 68%, which is one of the highest rates in America. As a result of all this progress, Maryland continues to withstand the Delta variant surge better than just about any other state in America. Our positivity rate is the 6th lowest in the nation. Our case rate is the 2nd lowest in America. Our hospitalizations are down 60% from the peak, and we remain well below all of our pandemic surge capacity triggers. We're proud of the fact that we're in much better shape here in Maryland. We have been able to avoid the spiking numbers that other states are experiencing, with their case rates surging out of control and their hospitals overflowing. We're also encouraged that there are positive signs that our health metrics are actually beginning to level off. However, we also know that we cannot be complacent. Over the last several months, we've been actively preparing for the next phase of our vaccination campaign and laying the groundwork for a statewide operation for booster shots. As part of this preparation, last month we launched an antibody testing program for nursing home residents across the state in order to ascertain their current levels of immunity from COVID-19. This pilot program, which was one of the first of its kind in the country, included more than 500 nursing home residents from across Maryland, and the findings reported by the Maryland Department of Health indicate that more than 60% demonstrated some form of waning immunity over time, and showed that as many as 1 in 3 are now particularly vulnerable. A major study conducted in Israel, which was the first country to offer boosters to seniors, concluded that a booster or third shot led to an 11-fold reduction in cases of infection and a 10-fold reduction in severe illness. Our state has already administered over 28,000 boosters to immunocompromised Marylanders, and the CDC's Advisory Committee on Immunization Practices has now approved the use of booster shots and stated that nursing home residents should be prioritized to receive them first. Unfortunately, for several weeks now, states have had to operate without clear guidance from the federal government regarding these booster shots. The limited guidance we have received has been confusing and contradictory, and it is still unclear when and how more people will become eligible. But all of the evidence makes it abundantly clear that we cannot afford to delay taking decisive action to protect our most vulnerable citizens. So today, the Maryland Department of Health will issue an order which makes all Marylanders 65 and older who are living in congregate care settings immediately eligible for booster shots. This health order applies to all nursing homes, assisted living facilities, residential drug treatment centers, and developmentally disabled group homes. To be clear, these facilities in Maryland will not have to wait to begin offering boosters. Boosters can now be immediately administered, effective immediately. In addition, the Maryland Department of Health is issuing new guidance today, instructing all pharmacies and other providers across the state to administer boosters without any need for a prescription or a doctor's order to anyone who considers themselves to be immunocompromised. Some providers may ask you to fill out a simple form, but no one in this category should be turned away from receiving a booster. Providers will be required to report any third doses that they administer in the same manner that first and second doses are reported. If you're unsure as to whether you qualify for a booster, we encourage you to talk with your doctor or healthcare provider. State of Maryland continues to have a sufficient supply of vaccines on hand for anyone in need of a booster shot, and we are fully prepared to immediately move forward with making boosters available to the wider population immediately upon receiving the clear guidance from the federal government. Even as we ramp up this new statewide booster operation, our primary mission remains getting those first and second shots into arms. The vaccines are the single most effective way to protect people from severe illness, hospitalizations, and deaths. Only 0.02% of fully vaccinated Marylanders have been hospitalized. With the recent full FDA approval of the Pfizer vaccine, we're working to reach even more of our remaining 19% unvaccinated Marylanders who are eligible. This week, we will launch the Community COVID-19 Vaccination Project, a new $3 million statewide, community-based, door-to-door canvassing effort to directly engage Marylanders living in areas with low vaccination rates and in an effort to encourage more vaccinations and to provide health education in at-risk neighborhoods. We are also continuing to hold mobile clinics to reach people wherever we can, and vaccines continue to be readily available in every corner of the state. To find a provider near you, just go to covidvax.maryland.gov or contact our multilingual call center at 1-855-MD-GO-VAX, which remains open 7 days a week. Today, I also want to once again remind Marylanders about monoclonal antibody treatment, which is a critical tool that is also readily available all across our state. These monoclonal antibodies are the only approved and effective treatment for COVID-positive individuals who are symptomatic but not yet severe enough to require hospitalization. We've already administered more than 10,000 of these infusions, which have helped us avoid approximately 500 hospitalizations and more than 200 deaths. We've made these treatments available at facilities across the state, including the Baltimore Convention Center, City of Praise Ministries next to FedEx Field, and through a number of hospital systems, including the University of Maryland Medical System, Johns Hopkins, MedStar, Meritus, Tidal Health, Anne Arundel Medical Center, and Garrett Regional Medical Center. If you test positive for COVID-19, we encourage you to talk to your healthcare provider to see if monoclonal antibodies are the right treatment for you. To learn more about that, you can visit covidlink.maryland.gov or call 410-649-6122. In addition to the actions that we're taking here in Maryland today, we're continuing to call on the Biden administration to address the issue of boosters for Americans who received the Johnson & Johnson vaccine. Over 280,000 Marylanders have been vaccinated with the single-dose J&J vaccine, including those in some of our most vulnerable communities. We also continue to push for full FDA approval of the Moderna and J&J vaccines so that all Marylanders can have the same assurances as they now have with full approval of Pfizer. With our children back in school, we're urging the federal government to advance the approval process for vaccines for 5 to 11-year-olds. Getting our children vaccinated is critical to giving parents greater peace of mind. Unfortunately, we're being told that this approval is still many months away, and we've not yet been given any sense of a clear timeline. We will continue to keep Marylanders updated on all of these priorities if and when we get additional information from the federal government. Over the course of the last 19 months, with our focus on preventing hospitalizations and deaths, our public health response has evolved from an initial strategy of containment to mitigation and then to vaccination. And now, as we approach the fall, we're moving into the new phase of maintaining immunity. It is thanks to the millions of Marylanders doing the right thing and being Maryland strong that we have been able to reach this point. We have had one of the strongest health and economic recoveries in the nation by following the science and leading the way, which is exactly what we will continue to do. With that, I'd be happy to take some questions.
Governor, as far as those getting COVID-19 who've been vaccinated, you said in your comments there that it's a very small number that end up in the hospital. But are the number of people that you're looking at, the numbers and the metrics, who've already been vaccinated, getting COVID, is that number growing, and by how much?
It is growing, and the good news is the vaccines were designed specifically to prevent severe illness, hospitalizations, and death. And in that regard, they're working extremely well. But we are seeing an increase in breakthrough infections where people who have been fully vaccinated are getting COVID. They're just either completely asymptomatic or in most cases have very mild symptoms and they don't progress further. But it is still concerning, which is why we're talking about boosters. You know, we kind of jumped out early with vaccinating lots of people. It's now been, we started in December, so we're getting people that are up to around 9 months. There's an argument about is it 4, is it 5, is it 6, is it 7 or 8 months when you still have all the benefits. Well, some people are finding out, you know, that it does start to wane after a while. With Delta, it continues to mutate, and you know, that's why we want to stay on top of it.
In your conversations with the White House, what seems to be the holdup with getting the boosters out there and more information?
You know, I'm hopeful. I think the you know, they've scheduled a press conference to update us, maybe even as early as tomorrow. But you know, I've sat down a week or so ago with Jeff Zients, who heads up the coronavirus task force. We had a group of governors that also sat down together with them. I think they're trying hard, but there's miscommunication maybe between CDC and the FDA and the White House folks. And you know, I think they're maybe making progress, but they haven't communicated it to us very well. And most of the governors are concerned about that.
Governor, can you explain in a little bit more detail how you can authorize the boosters for the 65-year-olds and older, and then how we repair facilities when the FDA and CDC hasn't approved it?
Well, the FDA and the CDC has approved them for people that are immunocompromised, and we have a study that shows that our people in those facilities that are immunocompromised. So we're following the CDC guidance, but broadening the definition.
Question about the schools.
Yes.
There are currently 1,000 students approximately in CPS Montgomery County that are not in class now because of infections with COVID. This morning, the county executive, Mr. Elrich, said the county, if it has to, is going to go out and buy rapid tests because they need to rethink how they're approaching COVID in the schools right now. Have your administration had discussions with the schools, with health officials, as far as rethinking how this is approached right now, because we do not have children under 12 that are able to be immunized, and how close are you monitoring situations in schools right now?
We're monitoring it very closely. Not only the state MSDE, the Maryland State Department of Education is monitoring, the state health department is talking with all the local health officers and with the school systems. We've provided unlimited rapid tests and PCR tests to all the schools. We also provided $3 billion for them to make sure that they keep the students safe. I'm not sure, I know that our health department reached out to Montgomery County to say that they were you know, not following CDC or state guidance with this action that he recently took, which I think they're now reevaluating. But with respect to tests, this county executive was simply wrong, and we've reached out to him to say, whatever tests you need, we've already provided them, we'll provide you more, and I think he just didn't know what he was talking about.
If I could follow on your discussions with the White House, what are you hearing from them about children under 12 being vaccinated and a timeline on that? Because that seems to be the root of the problem some of these schools run into.
I think it's been something that I'm very concerned about. I brought it up directly in a one-on-one with the head of the White House coronavirus task force, and I was together with, I think, 10 governors in a longer discussion with him, and you know, governors of both parties across the country all concerned about kids being back in school and getting no real clear guidance about when we're going to have vaccinations. Look, we've taken it very seriously and had an amazing amount of success with 12 to 17-year-olds, which is keeping them safe. But the 5 to 11-year-olds, we're very concerned about. We don't want any, processes to be skipped. We don't want to rush something that's not, but at least tell us, where are we with the process? When might we expect it? And we've got no guidance whatsoever.
Governor Hogan, piggybacking on Rita's question about what gives you the authority to do this, I'm wondering about the J&J, people in congregate settings who got the J&J, or maybe members of the public who got one. What do you plan to do in these nursing homes for people who have the J&J? Will the booster be a different type of vaccine? What should those people, what do you advise them for their?
So there's multiple kind of confusing orders that came down. The EUA that came out on boosters for immunocompromised people included Moderna, J&J, and Pfizer. So we can move forward with booster shots for anybody that's immunocompromised, which we've now broadened to include folks that are in these nursing homes and congregate facilities based on our study. The other people who receive J&J are not eligible under the current CDC guidance, and we're asking to get that, be able to take that step soon.
I didn't know that J&J.
Yep.
It is.
All three.
So it is in that initial EUA.
Yeah.
Oh, okay, thank you. Thank you.
Governor Hogan, you noted that there has been a lot of confusion and confusing directives from the federal government. Do you have any worry that this announcement today is just going to confuse people even more?
No, I don't think so. I think we've been about as clear as you could possibly be for 19 months, and we're going to keep being as clear as we can.
If I may, so you took these steps today, you went by their kind of hazy definition, the Fed's hazy definition of immunocompromised. What next steps could you take, or are you talking about if they keep dragging their heels?
Well, so I think we have meetings about this every day. The health secretary and a great team of people from multiple agencies across state government is preparing and getting ready, because we believe we will be providing boosters to a wider group of the population. Perhaps we could hear something from the White House this week. There was some talk about some things happening on September 20th, and then they sort of walked it back. Hopefully by September 20th, which is fast approaching, in a few weeks we'll have some better understanding. But we're going to be prepared. We don't want to kind of start from scratch once we get that word. We want to be ready to flip the switch. Tom?
About capacity, you had built a large infrastructure in this state initially when the vaccines were first available. You are now going to have a position where when people come back for booster shots, there will be a lot of the people that went through that original infrastructure, which because the virus changed, you stood down. Do you need to re-implement that scale of vaccine distribution in order to meet the needs for the booster shot?
Well, I asked the same exact question myself, and we've been assured by our health department, our Maryland Emergency Management folks, and all the teams that have been working, that stood up the original mass vac sites, that we're not going to be able to do that. We should be able to handle this. We're in a new phase where we're no longer in an emergency situation. This is something we're going to be living with for a long time, and we've got to build the infrastructure to be able to handle it in a normal way. And so people will be able to get it at any doctor, any pharmacy, at thousands of locations, at other facilities, and we don't have to stand up those, National Guard mass vac sites with all the mobilization of thousands of, 11,400 people. We now have moved into a different phase.
And if I could, if you are now extending this also to people who say they are immune compromised and you do not need a prescription, are you not opening the door for anybody at any time now to walk in and get these immediately?
Well, just to be clear, this is the CDC guidance right now. You do not need, under CDC guidance, you do not need a prescription. And they have a definition of immunocompromised. You don't have to prove that you are. If you feel that you're immunocompromised, your doctor says, hey, you should probably get it, you can go get it. But there's been confusion from the federal government guidance that some pharmacies are giving people, some are saying, we need a prescription. Well, you don't need one. And so we're making it very clear in Maryland, somebody feels that they need to get it, we're going to get it to them, and nobody can deny it to them.
Are you considering allowing the legislature to vote early on the school mask mandate earlier than September 14th?
No. So there are only 2 counties that this affects. 97% of all the students in Maryland are already back in school and already requiring masks. Right now, there are only 2 counties left. It accounts for 3% of the population of students. And there's like a couple of days left or a week They asked if I would declare a state of emergency to waive the requirement for them to have hearings and hear from the citizens in those counties. Look, they're taking they're trying to override the will of that local jurisdiction. They should at least hear from the citizens about it. But 97% of the people in the state, it has no bearing on whatsoever. So it's not really much of a big deal.